Well, to avoid decay, in very short, brush twice a day, floss once a day, eat healthy, stay hydrated, and ditch smoking and alcohol. Always use soft brushes toothbrush. Proper brushing technique is important. The mechanical motion of brushing is what is removing the majority of the floss. So when you brush, focus on the technique. Take the time to make sure that your brush is reaching all the surfaces and cleaning every tooth. And don't brush too hard as it causes damage to your teeth. Coming to toothpaste, use about a pea-sized bit of toothpaste. Anything more is a waste, like in the picture, the red marked portion is all waste. Use fluoride toothpaste. Well, almost every toothpaste would be incorporated with it anyway. I know some people would be having doubts to use a fluoride toothpaste. Well, would make a video about it too. For time being, to know why they incorporated fluoride in toothpaste, click on this link. Stay away from abrasive toothpaste because it hurts enamel in the long run. Next up, floss. Floss at least once a day. And yes, floss is more important than toothpaste. If you have another version, please feel free to share it in the comment section below. Please visit a dentist or hygienist every 6 months for general checkup or a professional clean. Of course, a professional clean wouldn't be necessary if your teeth are already clean. And why you should go? A detailed version on the way. A child's first dental visit should happen shortly after they get their first tooth or around 12 months of age. The mouthwash used best right after your lunch meal. Use mouthwash for sure when you have any dental work, gum problems, oral piercing, and spacing between your teeth. Your doctor will tell you. I want to tell my routine here. Normally, I brush once a day. Sometimes, whenever my teeth feel fuzzy, like after getting up from a nap or fever, or whenever there's something stuck in there, I don't have floss. But when something's stuck in between your teeth, floss is the best choice, not toothbrush. I use toothpaste I like the flavor of or people at home will buy and keep. Mostly Colgate or herbals I like mint flavor. Only my wisdom tooth got caries which haven't erupted fully yet. I have to go for its removal soon. Rest are fine. Please don't forget to brush your tongue where a lot of bacteria can build up. I use a tongue cleaner. If you often forget to brush your teeth at night, leave your toothbrush on your pillow in the morning or before you go out to remind you when you get in or go for sleep. I don't think that sentence made any sense. Anyhow, the number one cause of tooth decay is frequent consumption of sugary foods and drinks. Eat less sugary foods and drinks and don't snack so much between meals. Because the number of exposures of meals and snacks actually matters more than the amount of sugar. So, like if you are sipping one soda all day, is worse than drinking two in 10 minutes. Anything acidic will demineralize and erode your teeth. To minimize the acid exposure to your teeth, use a straw and avoid swishing drinks around your mouth, or just have a simple rinse with water afterwards. Try to eat more fruits, vegetables, greens, nuts. Generally I like fiber diet, good for health, skin, and everything. I have to make a video about it too one day. A lot of videos to make. Well, eat calcium-rich foods like milk, cheese, and yogurt. They can help to neutralize acids and protect your teeth. Alcohol, especially if you also smoke, increases your chances of oral cancer. So it's your choice. If you are going to brush after every meal, then at least wait an hour for the acids in your mouth to neutralize and your enamel to refresh before brushing. Don't use your teeth as a tool and please avoid grinding and crushing on ice because that way you're exposing your teeth and the enamel that protects it to unnecessary amounts of pressure. This can wear away the tooth enamel or seriously fracture your teeth. Sensitive teeth, visit a doctor, don't delay. You cannot reverse dental caries. Well, there are lots of reasons for sensitive teeth. So visit a doctor and then use Sensodyne or any other desensitizing toothpaste for sensitive teeth. Again, your doctor will guide you. Also, anytime you do get dental work, be sure to ask how to care for it. Proper care helps make your dental work last longer. Babies and toddlers should not be allowed to go to bed or toddle around all day with a bottle or sip a cup of anything but plain water. And don't brush too much when you vomit frequently. Vomiting floods your mouth with tooth eroding acid. Alcohol until you vomit is also very bad for your teeth. In those cases, also if you have reflux problems, bicarb mouthwash would help. Please consult your doctor before you go for anything. And dry mouth, a common side effect of many drugs like antidepressants, anti-anxiety drugs, was so bad for teeth. Make sure you stay hydrated so your saliva flow is good and appropriate. Saliva neutralizes acids that cause decay. So to stimulate saliva after meals, choose sugar-free gum with xylitol is a good choice. Some people will need different resins, but these are the basics. I'll do some oral hygiene